All right. Hi, everyone. Thank you for joining us here today. My name is Kevin, and looking forward to sharing some information with you that we think you'll find interesting and useful, and start off a nice long conversation with all of you. All right. So I think you're going to see a variety of stuff here today. My name's Kevin Durr.
Thank you, Kevin. Do you want me to take it from there?
Yes, please. We'll introduce Justin and we'll start some information.
Awesome. Thank you very much. And you see my screen, Kevin? Let me just take a quick check on that. Awesome. Good deal. Never can tell. So thanks, everybody. My name's Justin Brockie, and we'll do a little bit more in the way of introductions as we go along. Just going to get you started and getting a sense of what we're doing. And one of the things I'd like you to remember is over at the right-hand side as we go through this, if you've got any questions for us during this presentation, you're going to be able to click that little down arrow and you can type your question in there. We're going to keep the audio as simple as possible and as turned off as possible so it gets clean. If you've been on webinars much, and everybody's on webinars all the time these days, I think, it gets a little nasty when you get noises and such in the background. So we're going to keep all that quiet. So if you've got questions, if you can type them over there aside, some of them we'll be able to get to today and we'll actually respond to you in typing there. Others we may have to take away and get back to you later, or folks from the state will get back to you later, and others we may address and sort of answer out loud at the end. We'll kind of see how time goes while we go through. But again, if you've got any questions, please do put them in there. It makes it useful for us as we go along to know what you're thinking, and it'll also help as we start building, frequently asked questions and things like that, just to get you more. So overall, what we're going to do is you're going to get a little introduction to the state in a minute. Then you'll learn a little bit more about Kevin and myself and Therap, and then we're going to introduce you to Therap's solution to EVV. And that's going to come in sort of three ways. We're going to give you some nice little animations, which hopefully kind of get the point across about why we're doing this and how we're doing it. We're going to try not to bore you too much with PowerPoint slides and walk you through. And then we're actually going to do a little demonstration. So again, this is not your training, and that's important to know, but just to give you get a little feel for what EVV's actually going to mean for you as you go along, and then we'll take it from there. So with that, I'm gonna pass you over to Kara. If you want to take things from here, Kara, I'll be moving your slides on for you, and it's all yours.
Hi, this is Kara with Senior and Disability Services. I work with training here, and I'm thinking that this is actually Anthony who is going to go ahead and speak to these slides. Our Deputy Director, Anthony Newman. Anthony, are you there?
Hi, can you hear me?
Yes.
All right. Great, thanks you. I just saw my red muted button went off and I didn't do a thing to make that happen. Very interesting. Hey, so hi everyone, I'm Tony Newman. I'm Deputy Director with the Alaska Division of Senior and Disability Services. I'm here for Director John Lee, who is unable to make it today, but does send his regards. I'm here with some other folks from SDS you've already met, and many of you I know Kara Thrasher-Livingston, SDS's wonderful training coordinator. I also want to introduce the two folks SDS is fortunate to have coordinating the EVV project, Jennifer Roberts and Lotta Frazier. They are deep into the details with Therap on how this will work and will be able to assist with questions you have for the division as we go along. So let me skip to the next slide. Do I do that myself? Thank you. So a little background, and I'll start very basic. What is electronic visit verification? It's a system that will electronically capture information about a visit at the time the service is delivered. Therap's presentation today will go into the details of what information is collected and how. Why are we doing this? One big reason is because Congress told us to. In the 21st Century Cures Act, which requires all Medicaid-funded personal care services and home health care services that are provided in recipients' homes to begin using EVV. Now, the original act required EVV for personal care services to begin on January 1st, 2020, but Alaska, like just about every other state, applied for and was granted a good faith extension to January 1st, 2021. So January 1st, upcoming, is the date we're focused on for personal care services. EVV for home health care services is not on the same January 1st timeframe, and the division will begin work on that piece on a future date. Okay. Next slide. Another important reason why we're implementing EVV is because we believe the use of EVV will improve the quality of care. It'll vastly enhance our ability to gather data to support quality improvement and program efficiencies. It offers the ability to gain a real-time look at utilization in the services provided, ultimately improving the quality of care for Medicaid recipients. EVV is going to improve our program's integrity too, by helping to reduce unauthorized services, validating service delivery, and giving us an additional auditing tool that can reduce fraud, waste, and abuse. Next. Again, Alaska will be starting EVV with personal care services, and here are those procedural codes. As you can see, this will apply to both Medicaid state plan personal care services and our newer community first choice personal care services. Okay, next. Now, Alaska has been planning for EVV since shortly after the Cures Act passed, with all kinds of meetings with many stakeholders. SDS, the Alaska Mental Health Trust Authority, Vitally Consulting and Coordination have all done statewide presentations to various stakeholder groups, open to the public and throughout Alaska, informing, educating, and seeking input and feedback as we prepared for readiness throughout the state. We've been participating with advocacy groups and professional provider groups in giving EVV updates. We've conducted provider surveys and agency outreach to gather information and view existing system demonstrations. And we also created an EVV page on the SDS website, as well as an EVV mailbox that people can email their questions to. We conducted a request for information process to identify companies that specialize in EVV that can comply with the 21st Century Cures Act. We did that to learn the types of system options that are available, what services are offered, quality metrics, best practices, procedures, and standards best suited to our state's varying geographic service delivery structure. We reviewed 4 model types, and based on stakeholder feedback and research on best practices, decided on an open hybrid model. Next slide, please. We requested funding and got approval from both the legislature and CMS. And finally, we developed a request for proposals to seek an EVV vendor, with the contract ultimately awarded to Therap Services. And our contract with them was just signed a few weeks ago. Next slide. And actually on to the next one too. Oh, this one. No, I'm sorry, that back. So we'll let Therap talk about the details of their model, but I want to emphasize that we've chosen an open hybrid approach that will allow providers to choose their method of EVV. That is, providers can either use the Therap system or an alternative system, so long as their system meets specific data collection requirements. This will give providers choice and flexibility based on their business models. Either way, the provider will need to submit data to an EVV aggregator, which we are working on with Therap now. Okay, that brings us to today. Before I turn it over to Therap, I want to note that we'll be repeating this webinar with the same information that is being presented today next week on Thursday, November 19th, starting at noon. We'll be sending out an SDS e-alert with registration information for that later today. So if you have colleagues that were unable to make it today, let them know that they can catch this presentation again. And with that, Therap, take it away, but know that the SDS team will stay online and monitor the chat for questions.
Excellent. Thank you, Tony. Appreciate that introduction. And to introduce myself, my name is Justin Brocky. I am the Chief Operating Officer at Therap Services. And as such, I do a lot of things, but primarily I work with our state contracts and have been implementing EVV in a number of states around the country. So we're coming into this, aware of the challenges and the opportunity that EVV brings to a state, both on the provider side and on the service recipient side, and we're committed to making this work. I'm also speaking to you as a parent of a child with some fairly significant disabilities, and we receive a bunch of in-home services in our own home. And I'm actually quite looking, and my wife as well. We're quite looking forward to when EVV comes, because we think it's going to be a benefit to us as a family. And I know there's a lot of trepidation out there. So one of our goals is to try and ease some of that, both on the provider side and on the state side, and as well on the service recipient and friends and family side of things as well. You met Kevin before. Kevin is our regional director for this area. I'm based in Connecticut. Kevin is based in Hawaii, so we're kind of covering all the time zones tonight. And Kevin spent a lot of time working with providers already in Alaska, and really will be running this project for us on a day-to-day basis. So you can expect to hear a lot more from him over the next couple of months and onwards as we remain committed to this into 2021. Let me just, I'm going to break up you having to listen to me through this whole thing by playing a few very, very short animations which explain why some of these things are happening or how they're happening. So let's start off with a little bit more about why we are doing EVV. Okay, so again, that's sort of the why, as we heard from Tony, is we're doing this because the federal government said we should. And what we're going to talk about for today is Therap's solution that we've built to implement the requirements of the Cures Act. Later on in future sessions, we'll talk about exactly what the rules and regulations will be around that in Alaska, and we'll get into training. This is today is purely an introduction and a kind of let's see what it looks like. The overall workflow here is we start with a service and an authorization. Okay, so you're going to be documenting services that were all authorized. Then that can go onto a calendar, and you don't have to put it on a calendar in advance. We know that a lot of services, particularly those that are more self-directed, don't necessarily get scheduled in advance, and that's fine. They don't have to be, but even if they're not, they actually go on a calendar to make them easier for you to use as they are checked in on. So the calendar either is there in advance or it's there retrospectively to check on things. Then the very heart and soul of EVV is effectively it's a real-time electronic timesheet. It is somebody when they arrive at the door to start providing a service is going to click on their phone and say, yep, I'm here. And when they're done providing the service, they're going to click and they're going to say, okay, that's me done. And based on that check-in and check-out time, we are then able to build a claim and send that claim off so that the provider gets paid. So if you can get all of that working together nice and smoothly, then it becomes a lot easier, because it saves you writing something down on a paper timesheet, typing that paper timesheet into a portal or into a computer, and then generating that claim. This way we can kind of automate the whole process. That really is the goal. Okay, so it's going to start off with the provider. Your service providers are going to need to enter those authorizations into the system. And the nice thing about that is all those kind of complicated rules, we've got them already there in the background, so you don't need to worry about them later on. Then, if you do choose to schedule, and again, please be aware, I'm going to show you another little animation about the options that we have available for scheduling or for not scheduling. So let's take a little look at this and see how this will work. All right. So a lot of information there. And again, I'm very, very aware that we're throwing a lot of stuff out at you. And I'm going to hope that you don't get too overwhelmed. And again, as Tony said right back at the beginning, we're going to be repeating these sessions. So you've got a lot of information available to you. We're also going to be putting them, and I'm going to show you where you can find out more information. If you want to come, once we get this downloaded, we'll post this session online, or maybe if the next one's better, we'll replace it with that one, and we'll get more and more training materials out there. We'll make these little animations we did for you. We'll post those, and as we get more decisions, and then when it is time for you to be trained how to do this, we'll be working with you very closely to do that. So as a reminder on that, wait a minute, we don't want to watch that again. Just take on to here. The options there for scheduling are important because, again, some of you as agencies will want to do that, but it is not essential. If you've got staff who you just want to go and provide the services they know what to provide, they're going to be able to do that. And then you get to the meat and potatoes of EVV, and this is really what it's all about, is checking in and checking out. And when it boils down to it, the big thing that I think we and the state really would like you to do, and what we've seen here at Therap as we've been working with folks all over the country, is doing this on a smartphone. Okay, so if you can do your EVV on a smartphone, then it gives you an awful lot of functionality. It becomes really easy to do, and it's sort of less work before and after. Okay, there are other options, and we'll talk about those other options as we go through, but almost all of them don't collect as much good data and actually end up being more work. So we've seen again, as we've worked with folks in other states, people say, yeah, I'm not sure if we're going to do that whole smartphone thing. And then as they've got into actually doing EVV, they're like, you know what? It really is much easier when we do that. So it's going to be a conversation you're going to have. There is a lot of change here. We're aware that there's change. So let's go and take a look at the various check-in options that are going to be available to you. And this is our last little animation of the day. Let's go take a look at this. Okay, and let me just share my screen. There we go. Okay, so and as Tony said right back at the very beginning, we signed our contract with the state of Alaska just in the last couple of weeks. So we're right at the beginning of this, and sort of policy decisions and things like that have not been made yet. So what I'm going to show you now and sort of review from that video is what are the options. Again, that there may be, you know, exactly when each one may or may not be required. That we'll get that information to you soon. Primarily, we want you to use your smartphone. Most providers that we're working with are engaging in some what they call bring your own device, where staff can use their own cell phone. It's all HIPAA compliant and encrypted, and it only captures, and this is very important, it only captures location at a point in time when you're doing your check-in. There's no other there's no tracking or anything like that. In fact, if as a service provider you didn't like having our app on your phone, fine, you can uninstall it in between every check-in and it'll work just fine, because it's not doing anything other than right at the beginning of your shift and right at the end of your shift, capturing that start time and the end time and the location. And I'll show you how that works on my phone later on, if the technology gods are with me today. So that's our primary thing that we want you to do. Just check in and check out. But we know, and this is particularly the case in Alaska, that, you know, there's a lot of space where there's no cell phone signal or there's no internet access in Alaska, and that's okay. Our mobile app works offline, and it doesn't capture as much data when you're offline, but even when there's no signal around, your phone can still see the satellites. Okay, so we can still capture a location, and then the next time you do have a signal, either you got a cell phone signal or you're back somewhere where you can jump on Wi-Fi, then it's going to turn around and upload that data. Again, very little data involved in doing this. It's just, and there's just a little bit of setup, and then you're all set to go. The app itself is free. It works on Android and on iOS. There are requirements there. It has to be at least Android 5 or iOS 10, which is not desperately new in terms of needing a cell phone. And the reason for that is we've got to comply with the latest security requirements and encryption on those devices. And if you go to an older phone than that, it's not as secure as the more modern ones are. There are other options though, beyond just using a mobile device. As I said, they end up, I think, actually having a little bit more work involved, but each one has its own advantage, and we'll get into more discussions with providers and service recipients and the state as to how these will work out over time. One of those is what we call a fixed device. And the way the fixed devices works is this is something that would stay at the service locations. That's usually in your home. And it's fixed there, and it's registered as being there by that big long number that's on the back. So based on that, what will happen is the staff who come out to provide the service, they can just press that button, and when they press their button, it puts up a number, and you can write that number down. And based on the device it came from and it looks like a random number, and it changes every 30 seconds. We can decode that back to being an exact time and date. So if you're doing your current paper timesheet process, and beside each check-in and check-out time that you are writing that on the timesheet, you press the button and you wrote down that little 8-digit number, we would be able to verify exactly the time that you press that button, and it could even get typed in at the end of the month or something like that. It doesn't have to. What has to be in real time is the pressing of the button. The typing of that number into Therap, that can be done later on, and you can take it from there. The traditional EVV, EVV is actually a thing that's been around for quite some time, And it used to be that it was always done over the telephone. Okay, you dial into one of those annoying telephone tree things and press 1 to check in and press 2 to check out, basically that sort of thing, and that is available with Therap. We've got functionality to do that. It's got its downsides as well. Again, fewer and fewer people have a genuine landline these days, and sometimes even when you think you've got a landline, you really don't. You know, if you're getting telephone service from the cable company, in reality, that's just another internet telephone. Okay, so again, I'm sure we're going to be working on policies for when IVR is an appropriate thing to use or not, but it is functionality that is available. And then finally, we have, and we described this deliberately as last resort data collection, and so you should have done one of the others, but we all know life has a habit of getting in the way. So you know, you're walking up the pathway to the house to provide a service, and you drop your phone in a puddle or in a snowbank or something like that, and it's not going to work. And now what do you do? Well, the last resort piece to that is you can always write something down on a piece of paper, have the service recipient sign it, get that back to your office or to your scheduler, and have that scanned in as evidence that yes, you did in fact provide that service. Again, the idea is not that that is what you're doing on a regular basis, but if all else fails and you need a way to prove that you were in fact there, then this is something, it's something that you can do. Then after that, we get to verification. And in most states that we work in, particularly at the beginning of EVV, this is an option, okay? It's not necessarily required, and we'll let you know about that. But we've got a couple of ways that you can verify service. One's signature, and one is voice. And with voice, it's quite as simple as, you know, you press a button on your phone, you hold it out and say, hey, could you just say that I did an okay job today, and whoever you're providing services says, yeah, you were here, thanks very much. And you've got that recorded, and that's a good way of proving that you were there. The other one is, you know, similar to maybe you were buying a cup of coffee at the coffee shop and signing for your credit card with your finger. You could sign on your phone with your finger. These are not ever stored on the phone. They're then automatically uploaded to our secure servers and kept there. Again, those are probably going to be optional, particularly to start off with, but they are there as functionality that is available. And we've had providers who said, you know what, we really like that. We'd like to use that even though it's not required by the state. Again, obviously, this is not going to all work perfectly all the time. There's going to be times when people forget to check in, and they're like, oh, they're halfway through providing the service, like, oh, I forgot to check in when I got here. Or maybe they check in, but they forget to check out at the end, or all sorts of things. So in that case, you know, that's okay. That's kind of built into the whole process, so we understand that could happen. And there's an ability for the scheduler to be able to go in and edit that. But if you're going to go in and edit that, you know, part of what we do here at Therap is make sure that there's really good data. And so we track when any of the data gets changed or edited. And in this case, you need to give a reason why you made that edit. So we'll end up building a list. There's a sample on the screen just now. Probably won't be exactly that list by the time we get through with it. And you'll say, this is why I had to do this manual edit. And that allows you as a provider to get statistics on how your staff does. It allows you as service recipients to make sure, yep, I agree with the way everything's being done there. And it allows the state to run statistics and reports and answer all the questions that the federal government is going to ask them. So it kind of lets everybody get in on that. I'm going to go through really quickly the fact that you can then take this data that we've claimed and that we've recorded and do your billing and claiming for it. Again, for those of you who are involved in billing and claiming, you're going to have lots and lots of questions. We know that, and we've got a great billing team here at Therap, and we know there's numbers of providers in Alaska who already bill through us, and that's great because it's going to make this process that much easier for you to do. We also know that there are providers out there who already bill through another software company, and we'll get to talking about aggregators and third-party vendors and things like that much more when we get to January. We're all in a little bit of a rush to get to January. We'll have guidance for you soon on what you should do so that you're prepared for January 1st and collecting data, but the rest of it will happen just a little bit later. But really the whole point here is you've collected a start date, start time and an end time for the visit, and you can use that visit data then to calculate, because we know all the billing rules, how many units of service that time was, and then we can build horribly complicated claim forms known as at 837, and you don't even need to ever see that. We'll build it in the background and get it ready and send it off to your MMIS so that you can get paid. And we'll do all of that in the background with you just doing a few clicks. And we've got the ability, either if you want to get that remittance file back and upload it into Therap, then we can make sure it adjudicates everything, or we can get it back and do that for you. And then we can give you lots and lots of useful reports. And that's one of our goals here. We want this to work for everybody. So the state's got all their reporting to do. We know as providers, you've got a lot of billing report that you want to do. You want to make sure you're using all your service authorizations properly. And again, as service recipients, we can even get into that. But particularly at a provider level, you make this useful data for you, because if everybody's looking at the data and everybody's using it, it's going to become much better for us all. And again, it's going to seem much less painful to go through change. And we all know change is difficult for everybody. So with that, what I want to do now is I am going to give you a really quick walkthrough of what this looks like in our application. I'm going to show you, first of all, a little bit of what this looks like in our web application, partially because it's a little bit easier to show on the screen and for you to see when I do it in the web application. And then I'll just give you a quick preview of what it looks like on the mobile app, mostly to show you how easy that is. Again, I'm aware that when I'm sharing my phone screen over a webinar, it's not the biggest thing, so it's not that easy to see. So it's really just to give you more of a sense of what that is and how that is going on. And then just a quick little reminder, if you got questions, please do click on that question tab over at the right-hand side and type your questions in over there, and we can get back to you on that as we go along. All right, quick drink of water and we'll get started on the demonstration. Okay, so I'm going to share a different screen here. Okay, so I am starting at www.therapevv.net, and I'm going to list that at the end, so you don't need to write it down, but it's where you can come if you want to find out a little bit more about what's going on with Alaska EVV. It's there's information. Again, at the moment, that's mostly just looking at the animations that we showed you earlier, and a link to the State of Alaska's page. But this will be somewhere in the future where you can come along and you can actually get into the Therap application. And the Therap application is a secure web environment. We meet all the HIPAA standards, and we go through all the licensing things that we need to do in order to do that. What I'm going to do today is I am going to show you this in a demonstration account where so it will be the real system, but it will be completely fictitious data that you're seeing. Nothing actually real there. Let's do a quick check with my Therap colleagues that you guys are seeing my screen okay?
Yep, see it all. Thanks, Justin.
Awesome. And if you've ever done webinars, anybody else out there, you'll know it's very easy just to carry on when you change devices and nobody's actually seeing what you're talking about. So I do like to check in and make sure. And it shows you that it's all in real time as well. So I've logged in with my login name and password, and now I'm in Therap. And the vast majority of what's going to go on in Therap for you folks is over in this one little box. You don't need to worry about all that other stuff that's going on, because you probably won't see it, because Therap only shows you the things you need to be able to access, and I just happen to be able to access everything. Just about everything is going to go in this one little schedule box where I can go in and work. What I'm going to show you briefly before I go there, though, is I'm going to show you how it might work if you chose to be a scheduler and schedule in advance. Okay, so if I'm in here and I'm looking at what's going on as a scheduler, I can see my schedule for the day, which is really nice. And I can see we've got 4 people that we're supporting, and I could see I've got 3 staff out of them there. One of them, which would be me, is really, really busy, and the other 2 aren't doing much. And again, I could look at this by the week or by the month. Lots of different ways to look at it, but I usually find this is easy to look at. I also know a couple other things are going on. I can see that there's 2 slots here that have already been checked into. That's good. But I can see these pink ones are those count as being approved without staff. So those are services that I hoped were going to get provided, but I haven't assigned staff to them yet. So I might want to get on that and make sure that happens. So again, if you are running an agency where you've got a lot of folks that you need to stay on top of, you might want to take advantage of this, but you don't necessarily have to. So let me go and say, let's say I wanted to pop in another visit for one of my staff during the day. All I need to do is kind of click and drag where I want to pop that visit in. And you see it's got the person's name. It's taken the start time and end time from when I did that. And I can choose which of my programs that's at. I'm then going to say, okay, so what service is it that's being provided? And what the system's doing now, it's looking at all my service authorization. So it knows what services, in this case, Jacob has been authorized to receive. So I can go in and say, I'm going to do personal care. And I know already how many units we've scheduled for today and for the week. So again, if I am scheduling it in advance, hopefully I can schedule the right amount of services. If you ever, and we get into the place where you schedule more than one service at a time, sometimes personal care and homemaker and things like that get done together, we've got options for that. Next, I'm going to look at staff, okay? And again, the system's doing a bit of logic in the background. So it knows which of my staff work with Jacob, and it knows which of my staff are allowed to provide which service, okay? So here I'm getting the grand list of one of who's allowed to both work with Jacob and provide PCA, okay? So that's good. And I can see how many hours Justin's been scheduled for this day and week, which is rather a lot because he's busy doing all these demos. But that's fine. Again, I'll get warnings about that. You can see warnings will show up at the top, but it's not going to stop me doing anything. I can now pop in an address. Okay, the system will know a bunch of the primary addresses that are around for this person. Again, this is one of my demo accounts, so I'm gonna use a Nebraska address. System also can default to just saying this is a home service, so it's always going to have the home, and that we can use that for the basis of things. It will also know folks' phone numbers. So again, if we need to do that phone number check to see if that was getting checked in at the right time, we can do that. There is a kind of approval process for shifts as they're getting put on the schedule. Again, up to you. How do you want to use that? The other thing that does, it lets you decide, if you're a scheduler, whether or when you want the staff to see their shifts. So if you're kind of making up the whole week in advance and you don't want anybody to see it until it's all finished, you can do it all in draft and then approve it once you are ready to go. And once you do that, that's going to show up on the calendar just like that. Okay, so really quite easy to do. What I'm going to do now is, that's enough about the scheduling. Again, if you're a scheduler and you're all about this stuff, we will be doing lots of webinars about scheduling. We'll be giving you training on all of that, but again, it's not required for what we do with the application. What I can do now is I can kind of switch hats and become one of the staff who wants to go in and check in. So I can look at my week, and I'm going to open up a shift that I already checked in for as I was getting ready for doing this webinar, and now I would like to check out. Okay, so I'm going to click check out here. Okay, it tells me where I am, and I confirm that, and I confirm that yes, I did. I'm just confirming that I did actually know what I do, and with that, I am checked out, and that visit has turned green. Okay. Now, again, some states are okay with doing check-in and check-out on a computer. Others don't like it. We'll get you those policies as we come along. You'll notice as well that there's a little red line around the outside of this, and that tells me that the check-in and check-out were more than 15 minutes off what the scheduled time was. Again, just another little kind of prompt as to how that goes. But now I can move on and carry on with the rest of my day. Again, one of the other things we talked about here was self-scheduling. So that was, if you remember what that was maybe the agency has said to the staff, hey Justin, you've got 20 hours this week to work with James. Go and put those on your calendar when you've agreed with James when he's going to do them. So maybe I'm going to go and work with James, and I want to put that on my calendar. So I can just basically do for myself the same thing that the scheduler could have been done. There's slightly fewer options because I can only choose myself to do it, and I can throw that in. Again, those are options here. or I could even do a self-check-in, okay? But I'm going to show you them on the mobile device as we go through, okay? So let me do this. Let me change my presentation mode again. Okay, and okay, so you are now seeing my cell phone. So hopefully nobody calls me in the next 10 minutes or so. And I am going to log into the Therap app here. Okay, and I'm going to use exactly the same login credentials that I used when I was logging into the web app up there. So it's going to be just the same. I've got a login name, a password, and what we call a provider code. The provider code really, basically, that is my my agency. So each agency is probably going to have their own provider code, and we'll go through that with you as we get you set up. And of course, I got that wrong. So that's what happens when you try and type and talk at the same time. So let's try that one more time. Okay, there we go. And let's try and get the right one of these. Okay, that's better. So that's I'm now logged into the Therap app, and again, I happen to be using an Android phone. Again, I am going to see all those things that I'm allowed to do. Therap's got basically a full documentation system. You're probably going to focus on the scheduling module when you go in. So I'm going to click on scheduling. And that's going to bring up that same calendar that was there before. Okay, that I saw when I went to check in on my computer, and you've got the same colors in those little bars. It's just nice and easy to kind of scroll around on the phone. So if I wanted to check out from working with Jacob there, that's really easy for me to do. And so I'm gonna click on that. And I see that checkout button down at the bottom. So I am going to check out there. I'd make the same attestation that I did before. And I'm going to do a mobile checkout. And it shows me where I am. So I can check on that. If I wanted to put a little comment in here, I could do that. And I can check out. So very quick, very easy to do, because that was all already there. And now that I have checked out, I've got, remember we looked at those verification options. So now there's a button down at the bottom that says that I can check out. So I'm gonna verify that. I've got the signature or the voice. I'm going to show you the signature because it's just a little easier to look at on my cell phone. So I do that, and I can sign my name there, submit that, and I'm all done. And again, that would have been me asking my service recipient or somebody responsible, can they go ahead and sign there. Okay, so that's me all checked out at before. So very easy to do, and I get that little green check mark just as a reminder that I'm verified. What we talked about before, though, was the ability to do what we call self-check-in. And that is, what are you going to do if you want to provide a service when there is no schedule? What does that look like? Okay, so let's go and give that a try. So I'm going to tap on self-check-in down at the bottom there. Okay, and I've got to do a little bit more data entry here because turned my chat off before. And so I'm going to choose the person that I'm working with. So I'm working with James. And again, which program I'm in, which is this one, and the service I'm providing. So I'm going to get that same list of services that I'm eligible to provide for James, who's on my caseload. So I'm going to do personal care. And so that's, again, a little bit more work, but not very difficult because the system knows enough about me as the caregiver and what I'm allowed to do. And I've got the choice here. I could do a mobile check-in, or if I previously had been somewhere where there was no signal and I'd written down a number from that little fixed device I talked about, I could do a fixed check-in, but I'm going to do the mobile one. And there it is. It tells me where I am, and I can check in. Tells me the check-in was successful, and that was it. So really, very, very easy to do that. Okay, so that's the self check-in. I can now do my work. When I'm done, I can go back and check out, and that will be as quick and easy as the previous checkout was. Last thing I want to show you here is the checking in when you're offline. Okay, so if you're going to be offline, one of the things you'll need to do is kind of do a little bit of setup, because obviously when your phone's offline, it's not going to get to the Therap server, so it's not going to get to your password and stuff like that. And we kind of don't want to leave anything lying around on the phone. So we ask you to put in a PIN number, which we will encrypt, and we will keep that locally. That's one of the few things that we will keep locally. Let me just make sure I remember what that is. So now I am all set for doing an offline check-in. And if I know which of these visits I'm going to do offline, that's really good, because I can just get them all prepared to add to my offline check-in just by doing a quick swipe there. And now, if I were to log out, and you'll notice on my login page just down, it's quite small, so I don't know where this, I'm showing a phone over a computer, so things are getting small now. It says switch to offline login. So I can tap that on that. My fingers are too big. And I can now put in my login name again. And this time, instead of using my password, I'm going to use that little PIN number that I collected. Now, when I do that, it is going to take me to a different dashboard. And that's because when I'm offline and I can't get to the internet and I can't get to the Therap servers, I can't get all of that data that we have to give a nice, easy, functional check-in. You know, so we just give you the visits that you've got, and it then becomes fairly simple for you just to say, okay, what I would like to do is check out from this one. Okay, I'm going to do a checkout. It asks me if I'm sure. I say yes. And that's it. Maybe I checked out there, and I'm going to check into my next visit. So I'll check in here. And I'm all set. So really, all it can capture, because you're offline, is it's looking at the sky and seeing the satellite. So it's getting a location, and then it's got a start time and it knows who I am. So that's me all done with that. I can then log out, and when I log back in and go back to my regular password, okay, I'm going to get that message of, hey, you did some work while you were offline. How about you upload that? Sure, let's do that. If I don't, it's just going to keep pestering me until I do. And then it tells me my data's been uploaded, and it takes a little while, and then that's going to be synced into that calendar so that when I do go back online, then I'm going to be able to see all of that data that was put there, and work with it. So let me change again what it is that I am sharing. So give me just a second, if you will, here. So I'm going to make the other me the presenter. Okay, and what you can see here is we are back at the schedule, and if I go and open up that visit that I did while I was on the phone, here's the one I started. Okay, you can see it's orange there, and if I were to open that up, I can see where it happened. I can see that the check-in was done on mobile, and exactly where it was. This is on Pacific time, so it shows up that way. If I were to go in and look at the one I checked out on, oh no, that's not the one I wanted. Let's go back. There we go. Here's the one I checked out of when I was on. You can see I checked in on the web, I checked out on mobile, and there's that signature that I did. So all of that stuff when we're doing it on the mobile is instantly getting synced back to the web application, so that my agency and my scheduler can know exactly what it is that I am up to. But let's go back to this one. Let's say I checked in for this visit, but I forgot to check out. Okay, it's like, so I've called my scheduler, said, hey, Mr. Scheduler, I'm really sorry, I forgot to check out. Can you help me with that? Okay. Well, the answer is, you can see there's an edit button here for the scheduler. So the scheduler can go in here, click on edit, and can in fact add in a time and date. Let's get this right. And say 3 p.m. and that's going to go there, but I'm going to have to put in an exception code. Okay, I'm going to have to say, why is it that I am doing this manually rather than taking the data? So I'm going to say that I forgot to check in, and I'm going to update that. And now that visit is checked out. So when I go back there, that visit is now green because it was checked out for manually, but going in there, it's got that exception code associated with it. Okay, so again, just keeping the integrity of all the data here, and making sure we've got good data here that is ready for you to build with. Okay, that's about what I wanted to do in terms of a demonstration today, because again, we'll have plenty of time to get into to how the billing works and all of that. Again, I think we showed you on our slides that was going to come from that we're going to use that check-in, check-out time to get you all your billing done. What I want to talk a little bit about is how this is going to work in terms of us getting you guys up and running. Again, if you are an agency and you're going to use a third party, a different vendor to use your EVV other than Therap, we will get some information out to you, and you need to let us in the state know about that. So keep an eye on the announcements for when you can do that. But assuming you're going to use Therap to do this, then again, we will end up getting in touch with you really soon so that we can work with you. You're going to meet some of our state team who are folks who are used to doing statewide implementations all over the country. So one or more of these fine folks will be getting in touch with you, and we'll as agencies, we'll work with you one-on-one, okay, to make sure that it's getting set up right for you, and we're getting you to the place where you're ready to have your staff out there doing their check-in and check-out by January 1st, and you're ready to do your first billing cycle whenever that comes true. Because we're doing this in a little bit of hurry. Again, we've got a big team of folks from all around the country who can help, or if you're asking for support through our website on our live help, it could be one of these folks. These are all people who have done something similar to you. They're really all people who've come out of the human service provider side of things, so they know what it is that you do, and they're going to be able to help you do that. We're going to give you plenty training materials. Again, don't think you got to write everything down at the moment. You'll have handouts and some automated training and videos and recordings to do. Again, we don't want to give you those now because we want to make sure we've got all the rules tied up, so we're training you how to do it properly right from the beginning. Again, if you want to go back and you want to look at those cute little videos again, you can go to therapevv.net, or you can do the /AK and get right to this page. You'll also there be able to see as we get more of these scheduled. Tony talked about one coming up next week. We'll get that up there shortly. We'll also post the recordings, and that's where you'll be able to sign up for more information and tell us that you're using a third party and things like that. So again, good page to keep an eye on. It's also, if you forget how to get there, it's got a link to the state EVV page. There's the state email address, DHSS EVV. If you've got questions for them, for us, it's aksupport@therapservices.net, and we would be happy to do that. With that's about what we wanted to go through with you today. I am going to open it up. I don't know if based on sort of questions in chat and things that came in, or other comments folks from the state would like to jump in on.
Hi, this is Kara with Senior and Disability Services. I just wanted to jump in for a second and first of all, thank you for this wonderful presentation, and to thank our audience for your excellent engagement with our questions area here. If you don't know how to enter a question, you can just hit the arrow and on your icon, and it'll open up a question area where you can type in your question. We do have plenty of questions here. We'll do our best to answer them as we go. And if there are questions that do not get answered during the session, please know that we're collecting them for frequently asked questions or further response at a later time. And thanks again. That's it. Please enter your questions.
Cara, do you want me to run through and answer a few of these questions?
Hi, this is Kara again. It would be great if we could go ahead and go through some of the questions that have already been asked and answered so that our audience can
Awesome.
get an idea as to what we're all thinking about.
Okay.
Yeah, that would be great.
I will start on them. I think there's a few there I could pass over to you if we go through, if that's okay.
Okay.
Folks wanting to know if the PowerPoints are going to be available. Yes, we'll get them posted on that Therap EVV website probably over the weekend, and those will be available. And somebody asked where I came from, and I happened to grow up in Edinburgh, Scotland. But so thanks for that. Somebody's trying to subscribe to the e-alerts, and they weren't quite sure how to do that. Is that something you can give quick instructions on, Cara?
Sure. E-alerts are the best way to learn about upcoming events and webinars that SDS wants you to know about as a provider. So you would go to our website and sign up for them. This particular questioner stated that they had tried to sign up, but that they were not getting the e-alert emails. If that happens to you, I would suggest to go to your spam folder in your email and find the e-alert messages that have gone there. Sometimes the computer thinks it's spam or junk mail, and click on one and allow that address as a trusted address within your computer. If that doesn't work, maybe you're at an agency that has IT security, you could talk to them about that, because it's usually an IT security or the computer thinking that it's a spam mail, because we do send that out to everyone on the listserv, so your computer kind of knows that it goes out to a lot of addresses. So that's it.
Excellent. Somebody asked how user-friendly it is making corrections, and I think that was before I'd done the demo, so hopefully you saw that, and you saw that wasn't too tricky if you need to fix a check-in time or a checkout time. Another question here is, once EVV is up and working, will paper timesheets still be required? We haven't made that decision has not been made yet, but again, obviously the goal here is to make things electronic and try and get everything. And I know there's documentation associated with timesheets, so that's one of those things we'll be looking at. Until you hear otherwise, I would say don't stop doing those timesheets to start off with. If there are, and again, agencies that are using a different system, and again, this is what we tend to call third-party vendors. So if you've already got a computer system that you're using for your documentation, that's fine. We will be releasing our what's called an aggregator, which is the way that third-party system sends its data into the state. That's going to come in 2021, and you'll get more instructions about that. But it's important that you register that, and we'll give you a means to do that soon, that with the state. And it's important that you talk to your vendor now. So your software vendor, you need to make sure that they're going to be able to A, give you proper EVV data, and B, they're going to be able to build an interface so that data can get submitted. And based on experience we've had elsewhere, I would encourage you to start that conversation now, because software companies doing this now, to include Therap in that, are really, really busy at the moment. Okay. Again, somebody said the videos were a little hard to see, and I apologize for that if it was on our end. Yes, you can go and see them again at the website that's up on the screen. I'd encourage you to do that. I think they do a nice job of a straightforward explanation, maybe even help you explain some of this stuff to your staff. Good question there about whether or not if an authorization wasn't available, you'd still be able to put in a temporary one, so that if you're expecting that authorization to come in, we'll teach you how to do that. So that again, one of the prime things about EVV in the guidance that comes to effect is it shouldn't stop somebody receiving a service. So if as a provider you would normally provide a service, on the basis that you expect to get an authorization in the future, you shouldn't change your practices on that, and we'll work with you on how you get that into the system. So the little devices, the fixed devices where you write down the number, it's an 8-digit number. Again, it doesn't get scanned into the system. It gets typed in, but it's just an 8-digit number that the staff would write down. And again, it's that number that captures the time and date and will get put on it. The overlapping, question of will scheduling and staff check-in deny overlapping? And again, I'm not going to answer any policy questions here, but I'll talk about it from a system perspective. Is we don't want to stop people checking in and check out. If one of your staff went to check in and suddenly got a message saying, sorry, somebody already checked in for this slot already, or something like that, and didn't let them check in, well, maybe the second staff was the right one and the first one was the wrong one. So to start off with, we will collect all the data in every situation where we can. And then once we've been through all this with the state and we know exactly what all the rules are, then we can put rules in place. And there may or may not be rules there that say you will or won't get, this claim will or won't get allowed based on whether that's overlapping or other rules that come along. And again, we're still fairly new to this in Alaska and working out what those rules are, but our goal is to build in as much of that logic as we can. Again, the question of if an employee forgets, that's fine. Again, if the employee forgets every single time they go to work, again, that's going to show up in reports and questions that will get asked. But particularly in the early days, there's going to be some bumps, and that's why we have those edits in there as we go along. So this is another good question that I want to make sure I'm really clear on. And the question is, once a provider checks in, is that provider then getting tracked? And the answer is no. It is just a point in time check-in right at the beginning. Then we don't do anything until you sign in again at the end of the shift and you check out. Even if you have to stay checked into the Therap app, maybe you were doing something else in there, we're still not monitoring location other than that instant that you press the check-in button or the checkout button. There's a question there for SDS about what happens with authorizations during the fair hearing process. I'm going to guess that's one that we'll get back to you on because we're still working on the exact rules around that. If it is, good question here, what are the options for DSPs without smartphones? The options then become, do you go to the fixed device? Do you go to IVR? And that's something you want to think about at a provider level is how are you going to support that? What are your other things? And we're happy to have conversations with you at Therap as what we've seen other providers do. And I imagine that the state will end up being able to have conversations with you about that. In offline mode, the data is stored until you go online again, basically. Now, if you happen to drop your phone in a puddle and break it before you sync it, that data is going to get lost. So you don't want to leave it lying there too long. If this is another good question. It said the question is, would a consumer need a separate fixed device for each service line? And the answer to that is no. The consumer can have one device at their home, and that can be used by anybody who comes in and provides services there. In fact, if that consumer chose to receive services from multiple providers, they could all use that one device. That one device is enough to establish location. Again, another good question. Will the system deny entry based on exceeding authorized hours? We want to start off with, okay? Again, we're going to collect the data because maybe it's one of those scenarios where you've asked for more hours, but they haven't yet been authorized and you're okay with doing it. Or maybe the hours that were wrong were earlier ones. So we won't submit claims that go over the authorization, but we will collect the data on the front end. We always, again, our model is always to try and collect that at the beginning. Question of will we require the signatures, so that finger signature? We're not going to require it, at least to start off with, because we haven't verified the rules yet. And even so, what we are seeing nationally as a trend is that the state in general is having fewer requirements to start off with because they know it's a big change for you guys to get used to. And then probably more and more as we get into it and you guys and your staff get more comfortable, then we will probably add more rules as we go through. Will the EVV stay up to date and track the units that are used and what is left? If you are billing through Therap, then yes, we will keep track of that and let you know how you're doing. In terms of what will happen with other documentation, there's a few questions around here. That will, again, how the requirements, whether it's what stays on a paper signature and how you do your documentation, how that works. Not sure exactly when we'll get back to you on that because we've got a lot of stuff that we're working, but we will get back to you on that. Next question is obviously from a Therap customer, and thank you for that, because it asks about ISP data. So if you happen to be a Therap customer and you're using our day-to-day documentation module, which is ISP data, and you want to carry on doing that, you can link your ISP data and your EVV, and your support staff would be delighted to talk to you about that and show you how that works. Other people may learn about that in the future as we go forward. You are not required to bill by Therap, but you are required to collect EVV data for these services. So if you don't want to bill through Therap, I would advise, and this is my advice, would always be to collect EVV data and to bill through the same system. So if you're going to bill through Therap, collect EVV data through Therap. If you're going to bill through another system, collect EVV data in that system. Because on the back end, when our aggregator goes live, it is going to make sure that the data in your claim matches the data that you submitted for EVV. And that's always much easier to keep in sync if they come from the same system. So again, you don't have to do it through Therap, but I would very, very much encourage you to do it through the same system. So again, just a clarification on when I said we only track when you're checking in and checking out. So yes, that's it. Other than that, now you may stay signed in for a little while on your smartphone. It's a good idea just to sign out, but if you don't, we'll sign you out after about 15 minutes. But we're doing nothing active. It's not. This is not a system that is tracking you all the time. Even if, for example, and this happens in some other states where agencies want to find out how much mileage somebody drives during their visit, if maybe take somebody out for recreation or to maybe go and do groceries. We actually don't do that, okay? Because we're doing a start time and an end time, and the start time and end time are at the same location. We don't know where you went in the middle. If you do want to track that, there is a field where you can have your staff type it in, but we're not tracking all that driving that's going on during a shift if it is. Okay, just carrying on through here. So some really, really good questions here. And that. Nope, there's a question here of will the agencies have to pay into the Therap system? Therap is being paid for by the state for the EVV functionality. Again, there may be some things which we haven't quite decided on. You know, if you wanted to use the fixed devices, or if you wanted to use other functionality that's not covered by the state, and as we work that stuff out, we will let you know about that. Next question is, does the billing include a place for adjudication? And that is yes, that is included with the functionality you get as part of the state EVV contract. So if you get 835s back, just to be technical, which is the adjudication, you can upload that into Therap, and that'll get logged against the claims we've sent on your behalf. Says here, will provider agencies be responsible for entering staff and caregiver relationships into Therap? The answer to that is most likely yes. There's a bit of data entry that you guys are going to do on the front end to get things set up. We'll work exactly what that is as we're going through. I'm going to take a quick touch base with the state team members that are on the call. We are at the end of our hour and a half. I'm happy to answer the rest of the questions. Would you like us to stay on and do that, or do you want us to stop at the time and post the answers later? I'm comfortable either way.
This is Tony. I would suggest that we prepare our responses to these in writing, and that we wrap up. If you want to answer one or two more, feel free. But
okay, I will do. I'll do a couple more, and then we'll, again, if you did ask questions, and I'll check the answers, because I can see that a lot of answers got typed in by our staff and the state folks who are on. And thank you to everybody. Thank you all for asking so many questions. These are great, and make it more interesting and give us a sense of what you're interested. Keep an eye on our websites, and we will be posting information. Question there: what about capturing tasks provided you didn't see that in the demo? We've got a few different ways of doing capturing tasks, and because we haven't discussed it yet with the state, didn't want to show you the wrong thing, but watch this space for more information in the in there. Similar sort of question about, can that comments box be used for capturing some data? Yeah, it can. You know, there's some of this that is going to be up to you on a provider level for how you want to capture various pieces of data as you go along. So I'm gonna bring things to a close there. And again, I just want to thank you all very much. We're really excited to have this opportunity to work with you all and to work with the state of Alaska. We will have much more to say on this. Please do come back for future sessions, and do please keep asking questions. Tony or Kara, anything you'd like to say to wrap things up?
this is Tony, Justin. I just want to say thank you. What a great complete presentation, and thanks for taking all those questions. Appreciate it, and look forward to doing it again.
Excellent. Us too. Thanks all. You folks have a tremendous weekend.
Thanks, everyone.